Hello and welcome. My name is Chris Campbell, physical therapist and owner at Sport and Spine Physical Therapy in Portsmouth. My staff and I often get many questions over and over again in our clinic. Some of those questions include anti-inflammatories. What are they? When do I take them? Are they bad for me? When should I stop? So I wanted to seek out an expert in this topic and came across Travis Palmer. Travis Palmer is a nurse practitioner at Whole Life Healthcare in Newington, New Hampshire. So I'd like to welcome Travis to this talk. Welcome.
Thank you.
Thanks for being here. I appreciate it. So it's my understanding that you have been at Whole Life Healthcare since about the fall or summertime of this year?
This year I started full-time working at the beginning of October.
Well, congratulations. And prior to that, where were you, Travis?
Prior to that, I was working as an emergency department nurse at Portsmouth Regional Hospital while I was completing my master's program for the nurse practitioner degree.
And that nurse practitioner program, my understanding, was at Northeastern?
Correct, Northeastern, as well as I got my BSN from Northeastern as well and kept going through for my master's.
And why did you choose Newington?
Well, I had been living in Boston, working as a nurse down there in the ER and ICU at Beth Israel Deaconess. And I had come up here originally to begin my clinical rotations at Whole Life Healthcare with Amy Coons. Just kind of fell in love with the whole Seacoast area, and my wife and I decided to move up shortly thereafter.
And did you grow up in New Hampshire area?
No, I actually grew up in New Jersey and then started going to college in Boston. I lived there for about 10 years and made my way north.
Excellent. Well, welcome to New England. We're happy to have some good scholars like yourself here.
Happy to be here.
So this topic of anti-inflammatories, again, I'm sure you hear a lot of these questions in your clinic. We hear lots of questions. So what is an anti-inflammatory?
Well, an anti-inflammatory is a medication that you would take to decrease inflammation, typically from an injury or some sort of autoimmune response, immune disorder. So there's various different kinds of medications that you can take, different supplements. But typically when you're talking about an anti-inflammatory, you're thinking about pain relief.
So one might have pain. Let's say they fell and they twisted their knee. Would you suggest taking an anti-inflammatory right away? Would you suggest waiting a couple of days?
You could start taking them right away, especially if you have an acute onset of pain. You want to combine that therapy with, the RICE protocol, which is rest, ice, compression, and elevate, as well as adding an anti-inflammatory such as Advil, Motrin, ibuprofen, naproxen. Some of those are the over-the-counter medications that you can take that are anti-inflammatory as well as pain relieving.
Great. So you mentioned a couple of anti-inflammatories there. So some of the most popular ones are Motrin, I've heard before, Aleve. Are there differences between the two?
Differences in the fact that they're a different chemical compound, but they're both non-steroidal anti-inflammatory drugs, or NSAIDs. So those are in a different class than, say, aspirin or Tylenol. But those are typically the most useful for over-the-counter anti-inflammatory and pain relief.
Would one take the same amount of pills for each of those medications, or those different dosings on those?
Very different dosing on those. So with Aleve, you would take 1 to 2 tablets twice a day as needed for pain, and you would typically do a course of 5 to 7 days, depending on the severity of the injury and how much recovery you needed. Whereas Advil would be, you can take 2 to 4 tablets every 4 to 6 hours, not to exceed 3,200 milligrams a day.
And again, you said to take that roughly about 5 to 10 days. Is that what you said?
You can take it 5 to 10 days as needed. Beyond that, you certainly want to consult with a medical professional.
What kinds of things would one want to look for prior to those 5 to 10 days to suggest that they might want to see their doctor earlier? Say something that might be a side effect to one of the medications that they're taking.
Well, as with everything, there's certainly side effects with these medications as well, and we really shouldn't confuse convenience of the over-the-counter for safety, because there are numerous side effects from either of those medications, specifically bleeding disorders. It can disrupt kidney function, liver function, can cause GI bleeding. Those are the kind of big ones that we're looking for, especially with those two medications.
Excellent. So definitely buyer beware. Just because you can get it over the counter without a prescription doesn't mean it's perfectly safe, and there's things that one has to watch for.
Correct, and certainly watching out for when we're using it long term. We definitely want to be looking at the organs a little bit more closely.
How would you define long term, Travis?
I would say anything after 2 weeks for an acute injury. There are different autoimmune disorders that may require longer term use for these NSAIDs, but that would more appropriately be covered under the care of a specialist.
How are these medications taken? Does somebody take a pill? Is it a powder? Is it something they have to go and get an IV for?
So the medications that you're going to get over the counter are typically oral, so either in a pill form or a solution or suspension form. If you were to go to the emergency department, say, they might do an injection of a similar type of medication, but anything that you're going to get over the counter will be either liquid or tablet form or capsule.
If a person was taking one of these anti-inflammatories and it was helping a little bit, but they thought that if they had something stronger that would help either more or faster, are there anything stronger regarding anti-inflammatories?
Those are going to be the strongest over-the-counter ones. There are certainly prescription non-steroidal anti-inflammatory drugs that can be prescribed. However, there is some efficacy if you alternate with Advil and Tylenol. Those are two different forms of medication, both aimed at relieving pain, and that's safe in an acute setting.
What about what the athletes have been known to take, steroids? Is that something that reduces inflammation? Is that something different?
Well, it's two different kinds of steroids that we're talking about, I imagine. The ones that the athletes are taking are more androgenic based to develop muscle, reduce inflammation in between recovery time, and gain strength quickly. The steroids that you would see more conventionally in a medical setting would be your corticosteroids, such as cortisone, dexamethasone, prednisone is often prescribed for inflammation, but those wouldn't typically be used for, say, if you, as you mentioned before, kind of fell and twisted your ankle. Those would be kind of reserved for a little bit more of a severe situation.
What might be a severe situation that one would be prescribed, say, one of those stronger steroid type medications that you mentioned, like prednisone or cortisone?
Okay. So take cortisone, as everybody's kind of heard of cortisone injections into a joint, and that would be a specific joint for a specific reason to cause reduce inflammation in that. So that's not something that we would typically jump to right off the bat, and that would certainly have to be referred out to an orthopedic specialist.
Thank you. Are there other ways to reduce inflammation? So you've mentioned the RICE effect, which is the rest, ice, compression, elevation. We talked about non-steroidals, the anti-inflammatories over the counter. We talked about stronger steroids that you can either inject or you can take orally. Are there any natural ways besides ice to reduce inflammation?
There are, and again, they're not as well researched as some of the more conventional medicines that you would find over the counter. However, there are certain studies saying that they can be effective for certain conditions. Take turmeric for one, has a pretty high efficacy rate for the treatment of gout, which could also be treated with a leave or another non-steroidal anti-inflammatory or even a cortisone injection. But this would be a more natural way of addressing the situation. But again, don't confuse natural supplements for safety either, because all of them will have side effects as well. Turmeric, for example, has a risk of bleeding as well as GI upset and that sort of thing.
Have you had any experience with either taking it orally or topical arnica?
The research that I've done on arnica is that it shouldn't be taken orally, just because of the risk of GI upset. But topically, it can be effective, certainly in reducing the longevity of bruising and reducing some of the acute muscle inflammation.
And how about just generally one's diet? Are there any foods that will tend to support a greater amount of inflammation in the body if they eat, too much of this or excess of any types of foods?
If we have somebody coming in with certain joint pains or abdominal discomfort, some of the first lines of defense that we can look at are as their dietary habits. The most common culprits can be dairy and gluten for a lot of people, so reducing some of those dietary foods, we can kind of address some of the inflammation systemically.
So lots of different ways to reduce inflammation, whether you have an acute injury. How about with chronic injuries, chronic inflammation? Do these things work the same as they do for an acute injury?
They do work the same in that the body processes it the same way, and they're trying to, they're acting on the same processes of inflammation throughout the body. But with longer term use of these medications, you certainly want to be under the care of a medical professional, so we can check for kidney function, liver function, check for any internal bleeding, any other signs of organ failure or side effects from long-term use.
Again, as you stated earlier, just because they're over the counter doesn't mean that they're perfectly safe, and making sure that one communicates with their provider like yourself when they're taking that and they've been taking something like that for a long period of time. Super, super important, it sounds like, to have a watchful eye on these things for not just the inflammation, but other organs and other systemic issues that could come about with taking the type of medication.
Right, absolutely.
So your role at Whole Life Healthcare is what?
So I'm a family nurse practitioner, board certified with the American Academy of Nurse Practitioners.
And are you currently accepting new patients?
I am, absolutely.
Great. And do you have a particular demographic of patient that you accept?
I accept patients from birth through geriatrics, covering a wide range of chronic disease, as well as just maintaining general health.
So you could basically treat everybody in the family.
Yes.
Well, we really appreciate your time, Travis, and your expertise. And the New Hampshire Seacoast is fortunate to have somebody like yourself with your background and knowledge, your years in a hospital setting as a nurse, and then coming out of grad school as a nurse practitioner, and seeing the whole spectrum of life, and keeping us all healthy and safe. So we really appreciate it, Travis, and we appreciate your time today. And thank you for being with me today.